Landmarks for a surgical airway would include the thyroid cartilage, the cricoid cartilage, and between the two of them would be an indentation, which would be the cricothyroid membrane. We would like to make a transverse incision across the cricothyroid membrane and then dissect directly down into it to insert our airway. Landmarks for the needle decompression of a tension pneumothorax would be the third intercostal space. A way to find this on the patient would be to locate the angle of Louis and go laterally about mid-clavicular line, and this is where the needle would enter, to the superior aspect of the rib itself in the third intercostal space. Landmarks for a chest tube are generally the fifth intercostal space, and the ribs can be palpated. This is generally in line with the nipple, but on a somewhat more corpulent patient, you may need to use a hand to find this landmark. And at all costs, we do not want to put a chest tube through a previous wound. Landmarks for diagnostic peritoneal lavage, generally we would be going directly below the umbilicus in a vertical manner. There are several caveats to go above the umbilicus if the patient is pregnant or has had previous lower abdominal surgery. Landmarks for IV access, one vein would be the basilic vein, which would be found on this patient right here, approximately 2 finger breaths from the olecranon process and 1 finger breath from the antecubital fossa. That would be right there. Landmarks for the saphenous vein would be 1 finger breath above the medial malleolus and 2 finger breaths cephalad. Again, marking the saphenous vein right there. It's very easily palpated. You may roll it between your fingers. For the cut downs, we would like to do a transverse incision, being careful not to go through the vein on the first cut, but giving us room to go medial or lateral to find the vein in case we have not correctly identified the landmarks.